My name is Robin Yoder, and I'm the oncology social worker at the Sarah Cannon Cancer Institute and also the co-founder of the Hawthorne Cancer Resource Center. Coming up on my 27th year, I started right out of graduate school in 1990. For me, it wasn't really a chosen profession. It was, in all honesty, a poor graduate student finishing grad school with no money, and my first job offer came at Johnston-Willis, but it seems to have been, that's the direction I should have been led, and I'm a believer that if you go with the flow, you're taken to where you're destined to be. And I had cancer as a teenager, and so I've had cancer my whole life. I was treated and cured back in 1980 as a 17-year-old. So I always had some understanding that somewhere along my career I would want to work in oncology, but it wasn't a conscious decision when I was hired. But I knew when I got that first job, that's where I needed to be. I had a familiarity and I had a reference point, and I was entering the oncology social work world at a time where there weren't social workers to help people cope through their experience. My most memorable experience really goes back to my early days when I was learning, and the hospital itself was learning what an oncology social worker could do to enhance the care of their patients and support their patients. It had to do with, in a support group setting, I had a young 42-year-old gentleman who had pancreatic cancer. He had 2 young kids. He had a daughter at the University of Richmond and a son who was an 8th grader at here in Chesterfield County. And he was always very physical with his son, and that's how his father and son expressed their love for one another. But as his disease progressed, he lost that ability to be physical and wrestle and throw a football and tag in the yard and jump in the leaves, in his words. So I had to help him learn to find his words and his voice, to share a love at a different, deeper level with his son through his words, through cards, through a videotaping, similar to what we're doing, that he could share and express with his young son. Watching that relationship grow and watching him find a piece of himself that he didn't know existed and never was challenged, to really speak at such a deep, raw, vulnerable level with his son was a really beautiful experience. And that experience kind of set the tone for how I knew people needed to cope through this disease and just finding their voice. And that was something I look back on even today and draw strength from and inspiration from.